NCC Electronic Fetal Monitoring Certification Real Questions Practice Test. Question 1. True or false, adequacy of uterine resting tone measured by an IUPC should be validated by palpation. Option A, true. Option B, false. The correct answer is option A, true. Question 2. Which assessment or intervention would be least appropriate in a patient whose FHR tracing revealed tachycardia and a prolonged deceleration? Option A, change maternal position to right lateral. Option B, further assess fetal oxygenation with scalp stimulation. Option C, perform a vaginal exam to assess fetal descent. The correct answer is option B, further assess fetal oxygenation with scalp stimulation. Question 3. Which of the following pieces of information would be of highest priority to relay to the neonatal team as they prepare for an emergency cesarean delivery? Option A, FHR arrhythmia, meconium, length of labor. Option B, gestational age, meconium, arrhythmia. Option C, gravidity and parity, gestational age, maternal temperature. The correct answer is option B, gestational age, meconium, arrhythmia. Question 4. What characteristics are necessary for a reactive NST in a G3P0 patient who is 25 and 6/7 weeks gestation? Option A, accelerations of 15 bpm above the baseline lasting at least 15 seconds above the baseline. Option B, accelerations of 10 bpm above the baseline lasting at least 10 seconds above the baseline. Option C, any acceleration greater than 10 bpm above the baseline. The correct answer is option B, accelerations of 10 bpm above the baseline lasting at least 10 seconds above the baseline. Question 5. How long may a standard NST be extended in a term gestation if reactivity is not initially demonstrated? Option A, from the initial 20 minutes to 40 minutes. Option B, from the initial 20 minutes to 60 minutes. Option C, from the initial 30 minutes to 60 minutes. The correct answer is option A, from the initial 20 minutes to 40 minutes. Question 6. Which is the most appropriate application of vibroacoustic stimulation, fetal acoustic stimulation, in a standard NST? Option A, the device is placed at the top of the maternal fundus. Option B, the mother uses a marker button to document the fetal movement response. Option C, the stimulation is applied after a baseline is established. The correct answer is option C. The stimulation is applied after a baseline is established. Question 7. Which of the following characteristics are most common in the preterm fetus? Option A, increased baseline rate and prolonged accelerations. Option B, increased baseline rate and variable decelerations. Option C, prolonged accelerations and variable decelerations. The correct answer is option B, increased baseline rate and variable decelerations. Question 8. What typical characteristics of preterm uterine activity may be present in a patient experiencing preterm labor? Option A, an irritable uterus with wandering hypertonus. Option B, low amplitude high frequency contractions. Option C, tetanic contractions. The correct answer is option B, low amplitude high frequency contractions. Question 9. Which medications used with preterm labor can affect the FHR characteristics? Option A, terbutaline and antibiotics. Option B, betamethasone and terbutaline. Option C, antibiotics and narcotics. The correct answer is option B, betamethasone and terbutaline.